Hi everyone, it's Dr. Fox, and let's talk about the cavernous sinuses. In this video, we'll discuss the relationships of the ophthalmic veins to the cavernous sinuses, noting relationships of other neurovascular elements to those sinuses, as well as their clinical importance. So the cavernous sinuses are dural venous sinuses which flank the sella turcica of the sphenoid bone. That means they may be found lateral to this region. They enjoy connections to other dural venous sinuses within the cranium, as well as veins of the orbit and veins of the face by means of those ophthalmic veins of the orbit. Now, with respect to the cavernous sinuses, from an anatomical perspective, we want to understand structures that either are embedded in the wall of the cavernous sinuses or move through the cavernous sinuses. So there are four nerves which are embedded within the walls of the cavernous sinus. And here the dura mater has been stripped away so that we may either see those nerves embedded within the wall, or we may see some of the contents deep to the wall. So with respect to the location, so here's the clivus of the sphenoid, there's the sella turcica. Here we can see the internal carotid artery as well as cranial nerve 2. Now, the superior-most nerve running through the wall or the lateral wall of the cavernous sinus is the oculomotor nerve, which we can see there. Next is the trochlear nerve, which is a very small nerve located along there, and I'll have to delete as we go along. Next, we have the first division of the ophthalmic division of the trigeminal nerve, aka V1. And then we have V2, which is the second division of the trigeminal nerve, or the maxillary nerve, which is also embedded within the wall. Note, V3 is not embedded within that wall. Now let's take a look at the structures that move through the cavernous sinus. So here is the cavernous sinus kind of surrounding and flanking the contents of the sella turcica, which would be the pituitary gland. There. We can see those structures which were embedded in the wall. So there's the oculomotor nerve, there's the trochlear nerve, there's V1 and V2. But the stars here are going to be the internal carotid artery as well as the abducens nerve, our cranial nerve 6. Now, why this is significant is that if there is a cavernous sinus thrombosis, if an infection or a clot has moved posteriorly into the cavernous sinus from the orbit or regions superficial, this can interfere with the operations of any of these neurovascular elements. Now, one of the earlier signs of a cavernous sinus thrombosis would be the inability to abduct or abduct the eye because of a lateral rectus palsy. And that is due to an impingement from that thrombosis upon the abducens nerve. Recall, the abducens nerve helps to abduct the eye. Thank you so much for your time, and I look forward to seeing you in lab.